start because you guys are early and I really like that. Thank you for being early and on time. You want to get adjusted to? Not that I won't adjust you, tell me about it. All right, the reason why we start in a group, number one, and we both have been to chiropractors before, I understand, so I'll make this brief, but I want you to understand the doctor's report is the most important visit you will ever have in our office. Because number one, when we discuss your spine and nervous system as it relates to function and healing, when's the last time your doctor's ever talked to you about that, if it wasn't the chiropractor, right? And the other thing too, when I ask people, how do you know if you're healthy? What do you think most people tell me?
When I ain't in pain.
When you're not in pain, yeah. That's unfortunately not a good indicator. And here's the reason why. Most people tell me, especially men, if I feel good, I must be what? Fine. Until when? You're not. And here's the problem with that. When we look at waiting until we're broken and then doing something about it, would you agree with me that's very reactionary, not proactive? And is it possible to look good, feel good, and drop dead of a heart attack? Yeah, that happens to 56% of the population where heart attack or death itself was the very first warning sign or symptom. Number two, which has happened in my family at a young age, is it possible to look good, feel good, do right things like healthy lifestyle, exercise, and be diagnosed with cancer? So right now, 1 out of 2 men and 1 out of 3 women are diagnosed daily in the United States, and that's not good. Do you think that number is getting better or worse when we look at 5 out of 6 Americans are dying of heart disease and cancer in our lifetimes right now, in the past 5 decades? It's not getting better. And do you think that our healthcare is getting better or worse? Well, we really don't have a healthcare system, and I'm going to explain that. Yeah, it's not getting better as well. And so I'm going to show you some normal x-rays, and that's why we do nerve scans and take x-rays. We test so we don't guess. And I'm not going to put you on the big screen, I promise, but when we go back and look at your x-rays, you're going to know exactly what we look at, because I'll show you normal x-rays, case study of correction, and then like what's happened in our office and why people have made the changes that they did. And when we look at, the vast majority of people usually come to me with back pain, neck pain, headaches. That's typical chiropractic, like why people file in. But if I could spread the news about like 30 years of people coming off medications and changing, reversing disease process, and people who never even shared some of the information about their poor health and then getting their life and their health back on track through their spine and nervous system and correcting their spine, it's pretty remarkable. And as chiropractic saved and changed my life, and I'll share that with you in a little bit, that's why I stand before you and feel like you need to be highly educated so you make better decisions. I also feel like if we make better decisions on our health, we're constantly looking at doing that. So that's why we spend this time. I got one person to join us. Come on back, you can join us back here. So when we look at all healing and function from your brain through your spinal cord, out at every level, these nerves exit, they go to every organ, tissue, cell function of your body. Your heart beating, your lungs breathing, your lunch to digest, if you've eaten lunch yet, all comes through your spine and nervous system. And that has to go out to every area for 100% function, and that's what we're hoping for. From the side, you need 3 curves, a 45-degree neck curve, mid back curve, low back curve. And you're curvy, so you can bend, lift, twist, and do great things, but from the front, you want to be completely straight. Straight across your hips, shoulders, so if I cut you in half, ideally you'd be 2 equal parts. Most people aren't after a lifetime of, guess what? Poor posture, poor sleeping habits, trauma, chronic repetitive habits, injuries, falls, accidents. You go back to your youthful years, have you fallen off your bed, your bicycle, like all of these things add up to where you are today and the way your spine is performing and either building health and longevity or what? Going in the wrong direction, degeneration, changes, sickness, and even disease for a lot of people. And so when we look at where we are in healthcare in the United States, and then I'll leave this alone, a lot of people don't know. Americans think that we rank high. But when I line up 37 industrialized countries, number 1 being the best, number 37 being the worst, where do you think the U.S. falls? Go ahead and guess, dead last. Yeah, good job. Everybody's pointing down to the bottom, like the dead bottom of the sea ocean there. And the problem is, because we wait till what? We're broken. Then most people don't see me first. Guess where they go? Their general physician, right? What do they always do? Give you a drug. So in this country, are you ready? We are 5% of the world's population. We consume between 75 and 80% of the world's drugs. That's kind of disgusting, and that should make you mad, because what we do is perpetuate disease better than any other country. We are the worst country to live in past the age of 60 that can run or walk a mile and that are on no prescription drugs. Do you know what that percentage is? Less than 1%. That's bad, right? Yeah, whoa. So now when we think about who's responsible for our health, that's my other trick question. What would you say?
We are.
You are, right. A lot of people tell me it's my insurance or what my doctor says or what my spouse says, but I'm going to tell you right now, and I don't know if you live in the same insurance world as I do, because I provide insurance for my family and my employees. Do you think our insurance is going up or going down in cost? Yeah. I choose a higher and higher deductible every year because the cost goes up and up, and guess what? It covers less and less. So it's there for emergencies. It's there for crisis, God forbid, that we have to check into the hospital because spending a day in the hospital could be $5,000 or $10,000. So that's not where we want to be. We want to be building health and function. So I used this number one slide, and the reason being is, number one, I love this guy. He doesn't know I love him though. Henry Windsor is a neuropathologist at the University of Pennsylvania, very accredited medical school, published in the Medical Times. What he wanted to do was see the object of this particular study is determine whether a connection existed between the curves of the spine from the front and the disease of the organs, or whether they were independent of each other. So he took 221 dead people, all cause of death, like he's on autopsy, spleen, liver, kidney, heart, whatever, right? What he found was nearly 100% correlation between minor curves of the spine and the disease of the internal organs. He's been published several times since this in the Medical Times. But the reality being is, it's not about how old we are or how much injury we've had. It's about how are we building health and function every day. And if I put you on a timeline, hi, you can join us. 100% over here and 0% over here. This would be life, 100% abundant life. Guess what 0 is? Death. Yeah, you're not living or breathing. But do you know that most people operate between 40 and 60% in the US lifetime? Meaning they're waiting what? They're straddling that line between health and sickness always, because they're waiting for symptoms and signs rather than being very proactive about what we're doing from birth on up. And the very first subluxation does start at birth. That pulling, lifting, twisting out of the birth canal for children is enough, that 10 foot-pounds of pressure is truly enough to decapitate a human being. Most people don't know that. But that also will cause upper cervical issues from day one. And then we see kids developing asthma and allergies and other problems, and that C1, C2 is vital, and for the rest of the alignment of their spine as they're developing their spine and their spinal curves. So when I look at this x-ray, this is poster child for normal. This is not you guys. This is who all of you aspire to become. We want a nice reverse C-curve. So when you look at an x-ray, you're gonna see a measurement 45 that is normal, right? Yours is gonna be something /45. We look for nice square vertebra, fat equal disc spaces. These are the nerve holes, and where the nerves exit, that's where all that function and flow is going. There'll be 2 more measurements additionally on this one particular x-ray. We measure from the back of the skull, the C1, C2 vertebra. Right here, they need to sit 18 degrees separation apart, and that's pretty vital because your brainstem, that fat, juicy brainstem up there, exits into that first cervical junction, that's that C1 vertebra right there. Your spinal cord doesn't fully form till C2. A lot of people don't know that that's brain matter coming through they call the circle of Willis, or the mouth of God, believe it or not, the foramen magnum, and where all of that brain matter comes down to form the spinal cord. You need that fat, juicy spinal cord with no tension on it, so it's 100% firing, functioning, and flowing, right? This black space right here, I'm not sure why they call it free space. They should call it very important space, because that's where the nerves exit off the trunk of the spinal cord. They come out these little holes from the side, and we want those nice, wide, and open. And this is the hard bone and the soft tissue of the discs, and we want to protect the hard bone from the soft tissue of the spinal cord. This would be a normal, healthy MRI and a great cervical curve. This is what we want. So, when we look at a loss of a cervical curve, and I'm going to explain this guy, I'm going to explain this story in a second, but Alfred Briggs, a neurosurgeon, the last study I'll share with you, he calls this the arc of life. He did all of his work, he's a German neurosurgeon, did his work in Sweden, won a Nobel Prize for it. He said this is vital to have this curve because when you lose this normal cervical curve, it's like stretching, tethering, or pulling it tighter, 5 to 7 centimeters tighter. So think about, he calls this pathological tension on your spinal cord. So if I'm pulling a rubber band tighter, is it getting thinner or thicker? Thinner, right? If it's getting thinner, do you think the messages are firing faster or slower to the rest of your body? Slower. Now if they're firing slower by the time we get here, how well do you think we're building health and function out here to these various organs that need life force and energy and to build healthy function? Probably not well. So he said if we could restore cervical curves, and he took people who were already in disease process in his study, this is what he won a Nobel Prize for. People who lost full function of walking, they're in wheelchairs. People who are fully neurological and had to live on oxygen because they couldn't function without it every day, daily. And people had MS signs and symptoms, which is truly demyelination of the spinal cord and mostly having a reverse curve in their neck. And he said if I could restore a curve in their spine, because they all had straight or reverse curves in their neck, and reduce that pathological tension, they should restore function and healing ability. So what does he do? He's a German neurosurgeon. He operates. He chisels a curve back in their spine, wires them together, similar to having braces. The people who survived, because it is a bit barbaric, walked out of wheelchairs, literally had function restored to their legs. People who survived didn't have to live on oxygen assistance any longer. People had MS signs and symptoms, like 100% remission, like they never had the disease. So there's really a good hope when we find out that if we can restore this curve at any amount, adding degrees, any degrees matters when you take that tension off the spinal cord. So I show you this x-ray because you can see the pathological tension on the spinal cord and this bulging discs here and that straight neck. This is a guy who came to my office and he felt fine. He wasn't here for himself. He was here for his wife. A young couple, started crossfitting, mid-30s, right? And so she had developed sciatic pain, back pain, and butt pain. And we found the cause of her problem. But as we're sitting here in doctor's report, I always tell people to bring your spouse, bring your family members, because they support you in your decisions, but also they can get checked for little to nothing. We'll do a nerve scan, an x-ray, and see if you have subluxation. So he's like, oh no, just fix my wife. I work out, I CrossFit, I shop at Whole Foods, I'm healthy, I'm good. That's a 34-year-old man, because you're invincible until when? You're not. Okay, fast forward 6 weeks. His wife is under care and she's doing fabulous. Guess what? I get a frantic phone call. He's woken up in a hotel room. He travels for PPD and pharmaceutical research. He's a clinical researcher. He's got excruciating neck pain, numbness and tingling in his hands and fingers. Oh my God, what happened? What do we do? I'm like, I don't know what happened. It sounds like an injury or an accident. So the first thing, guess what I'm gonna do? I wanna examine and take an x-ray because I wanna find the cause of the problem. I'm not gonna guess. So he's like in Florida and he told us we're not coming back to the end of the week. I said, well, you need to see somebody right away. That's my recommendation. Hang tight. Call in a few max living doctors who do the similar work that I do. Some of my best friends lived right near where he was at. So I'm trying to get him in the office. No offense, gentlemen, he's a guy. He thinks he's dying. He goes right into the hospital because he's working in the clinical setting. The emergency room takes him back and they do an MRI and find 2 bulging discs in his neck. Look at the pressure of the spinal cord, the reach of that free space I talked about. And this is his x-ray when he got back. The moral of my story is we don't go from feeling fine one day to like having 2 bulging discs and a very straight neck. What happened was when he got here, and again, he wasn't listening for himself the first time, just supporting his wife. He's, how did this happen? Well, it turns out he had 2 car accidents by the time he was 19. He played 2 sports his whole life, 1 in college. Now he's crossfitting, which probably spawned a lot of this, lifting heavy weights over his neck and head, and look what he does for a living. He's in technology, and his neck is down in clinical research like 10, 12 hours a day on laptops flying around. So you add up all those things we talked about, poor posture, poor sleeping habits, trauma, chronic repetitive habits, injuries, falls, accidents. He's a walking time bomb, basically, and he was fine until he wasn't. So he came back all drugged up, because that's what the emergency room's gonna do, is gave him some steroids and some pain meds with a neurosurgeon referral. When he got here to Wilmington, he sees the neurosurgeon pretty quickly, and guess what they want to do? That's what they always do, right? So he's like, I don't want to have surgery. I'm 34 years old. Like, you said you could heal stuff like this, right? So this is now his story. And I said, yep, but it's going to take some time. We've got to get the pressure off of here, get the swelling down, and restore that curve. He never had surgery, got him off the drugs, and we restored his curve, and I'll show you this post-x-ray in a minute. But when I talk about how do we get this way, we work off of a 3-phase spinal degeneration or spinal decay chart. And so does the medical model. They make us think that DJD, osteoarthritis, spinal stenosis, all of these degenerative problems are age-related, meaning if I'm old and you guys are younger, that I should have more problems than you. But that's not the case. Because why do we have good-looking spines at 80 and we have terrible-looking spines at 40? Because if that was the case, it would be how long you've been breaking down, right? When breakdown exceeds repair, that's when we go into degenerative place. And if nothing is exceeding that breakdown, like that timeline we talked about, then we're going to move from one phase of damage to the next. So is it possible for me, who's been taking care of my spine for 40 plus years, has a normal curve, possibly with less degeneration, than a 20 or 30-year-old who walks in here with a very straight spine, no curve, and doesn't even know it yet? And guess what? 20-year-olds grew up in technology, always head down, on cell phones, on computers, Xboxing and watching Netflix. Like, none of that stuff was around like when we all grew up. And so now we are developing generations with no neck curves, and we are a sicker and less healthy nation than we ever have been. So if we leave that there, they say in 10 years, I say 7 years is average now. We move from one phase of damage to the next when nothing is changing this. And look at the breach of the free space, the pressure on the spinal cord. If you would close your eyes and you see something like this on your spine, you're like, that's not a good thing. This is breakdown, and how do I stop it? Because if you can stop it, get the pressure off the cervical curve or the cord, and start adding degrees back, you're adding healthy years of longevity. And when do we not want to be moving towards the 100%? That's like what we always want to do. We just weren't taught that starting at 0. And that's probably where we need to rewrite the script on healthcare. That's not up to me in this lifetime, but maybe my children, okay? You're fine. I'm going to show you 2 sets of x-rays. We're going to go back and look at yours. This is a lady who came to my office, similar to a lot of you guys who've been to chiropractors on and off part of your life. For her 15 years, she moved here from Michigan. Her story was she was taking Botox shots in the back of her head for migraines, 2 different major medications to try and control those, and getting worse. So when she moved here, she was having more frequent migraines than ever, like we're talking 10 plus a month. And she asked her neighbor, like, I've got to find a chiropractor, and they just happened to be a patient of ours, said, please go see our chiropractor. So we came in, we took an x-ray. And you see, when she saw this x-ray of a very straight neck, and it's supposed to be 45, right? The curve starts here, ends where that black mark is. She's at 8 degrees. Her atlas angle's flat. It should be 18 degrees separation. That's her migraine, by the way. It's at 6. So degenerative changes here in her lower neck that we think was from a fender bender a few years prior that she thought she was fine from. So she was upset. She said, why does my neck look so bad? Been going to the chiropractor on and off half my life, basically. This is a 32-year-old woman. I said, that is a great question. I have 2 more very important questions. So when's the last time you had an x-ray? Because things can get worse over time. And guess what she told me? She didn't have an x-ray. She went to a chiropractor who never x-rayed. Her hometown chiropractor was her same chiropractor in the small town in Michigan she grew up in. And then she said she'd never had an x-ray. She's had MRIs and CAT scans because guess what? Neurologists are trying to chase why she's having migraines with no avail, like just to keep drugging this person, which she's now not functioning well. And then I said, so my second question is, when's the last time you've had an adjustment, or how long has it been? Like, how often did you get adjusted? Because that really makes a difference in changing, because your neck does not look good. She said, well, I only went about once a month or 12 times a year. And I said, why? Guess what her response was? Why do you think? 2 things. It's always 2 things for everybody. Time and money. You got it. All right? And for her, they had an insurance policy that had a high deductible, little to no coverage. I think it was a federal policy. So she went to a chiropractor who never educated her, told her parents, see you next time, which means what? When you want to pay me for the office visit, or you feel bad enough, symptomatic relief, and welcome to the medical model, we wait until what? We're so bad that we want to go do something about it. So I said, that's not going to work, because imagine all those muscles and ligaments that house and protect and hold up your spine, and you get adjusted once a month to change this. Do you think that's going to change anytime soon? She's like, well, obviously it hasn't. And I go, you're right. And I had to compare having spinal correction to having braces. I'm going to tell you that story in a second. But when you start in our office, people have never seen cervical extension traction. The reason why we do it is we're pre-stressing your cervical curve, opening up all those disc spaces, pulling your head back over your shoulders. We do that in a pumping action. We're stretching all these anterior longitudinal muscles and ligaments that shorten and pull us forward over time. And we send people home in their home care if you don't have a cervical curve. You get on the wobble chair, and I know that it seems funny, but it's phenomenal. We wobble side to side, front to back in rotation, because that's the way our body moves in 3 dimensions, but we're pumping the discs from the bottom up. The research and science has shown that if you wobble up to 20 minutes a day, you increase your spinal longevity, guess what, by 5 years. So we want to wobble. And if you're pumping and opening these discs, see, gravity's pushing us down. These are bigger vertebrae, these are bigger discs. There's more room to be degenerative because we're stressing and pushing. When you sit down all day, guess what? You increase that disc pressure by 3 times the amount than standing alone. So as we wobble and we're opening these discs, we're keeping these nerve holes open, we're bringing vital fluid back into the discs, and we keep that full firing and healthy healing. You get a very specific adjustment based on your x-rays. That's why we wait. I look at your x-rays, I don't guess on what I'm seeing. Because if I adjusted you with this gentleman's x-rays, by the way, you are completely opposite rotation, you would hate me because it would hurt worse, or I'd never help you, right? And so when we are changing angles and we're looking at specifics of the cause of the problem and how to correct it, we're doing it specifically with our drop tables, our hands, the arthrostim. And then you get on the Vibe platform, which is truly been designed by the medical model. We stole the technology from the 60s. I was a product of the 60s, so when I grew up, my mom used to go to a women's gym. And if you could remember those big green machines with a belt around their butt, and she'd get on there and shake, shake, shake. And I'm like, what are you doing? Like, to me, that was really silly. I'm exercising, go play. I'm like, that's not exercise, your butt's jiggling. That's what it looked like to a 5 or 6 year old. But the reality is, it was designed to mobilize people, increase cellular respiration, it's proprioceptive, and a neurological reset of your body. So it raises your respiration rate for cellular turnover. So people who couldn't move, like cancer patients and overweight people who couldn't move, that's why they were selling it as weight loss, because it was mobilizing them and getting them to move more and turn over healthier cells. It also is neurological and proprioception. So now these Vibe plates are 3-dimensional. They go forward, back, and sideways. So when you're getting on them, why you feel so shaky is because they're resetting your whole body after your adjustment. And you'll see people on here head weighting, neck tractioning, even hip weighting, and body weighting on here. We change spines 3 times faster with this technology alone, which is phenomenal because we want to do the spinal correction and then put it in motion. So when I was at the Olympic Training Center working with the Olympic athletes back in 2012 before I went to the London Olympics, they had biplates all over their training facilities, because if you had an injury or an athlete that has sprain or a cast, they get on there a few times a day, believe it or not. In 2 and 3 weeks, casts are off, sprains are healed, and they're already back to getting to competing levels, because we want to advance them as quickly as possible to optimum performance. And then of course we adjust them, because that gets them firing and functioning at 100%. So I told her 3 times a week, and that's when she was the deer in headlights, because that's where we're starting. And she said, I don't understand, and that's where my braces analogy came from. I said, did you wear braces or pay for braces? She said, yep, 2 sets, but her girls were small back then. You guys pay for braces, wear braces? Yeah. So I paid for 2 sets for my kids, $6,000 they cost. It's lovely. Buy, down payment of a house for them now with that. But if we pulled those metal bars tight all in one day, what would happen to change their teeth? You'd be in the worst pain of your life. Your teeth could fall out. All sorts of things would happen. So we go back every 3 to 4 weeks. They change the wires, the brackets, the bands. They pull, they twist, they tighten. Over time, slowly, our teeth are moving and changing. They're taking x-rays all the time, like every handful of months, and we see the bite moving, the whole thing. My son also had to wear rubber bands to pull his bite back to equal his jaw space, right? Of course, he didn't do that. My daughter did great in 2 years. My son had to go 6 extra months because he would never wear his rubber bands. And that's like his exercise, right? That goes with correction. And so by the time we get our braces off, congratulations, you get to wear a retainer. Why do we wear a retainer? So your teeth don't move back, right? So we put her on 3 times a week. This is her 6-month x-ray. I'll put you side by side. She went all the way to full restoration, 45 degrees. Here's the best news of this story. Migraine stopped after a month and a half, and 0 drugs. We weaned her off all her drugs, because the drugs really weren't working, were they? They were barely covering the symptoms at this point. So we wanted to see what's going to work. When she got here, from here, and a month and a half, she said, so do I come less? Because we explained, no, we're staying on 3 times a week until we re-x-ray. And I said, no, because we want to get here, right? This is where we are optimum functioning again. So if we stopped, we would have never reached full correction, and she probably would have backslid pretty quickly. That was like my son trying to tell me about a year in. He hated his braces. His teeth looked straight enough to him. Take them off. And I'm like, not a chance. I've already paid for these, and you're suffering through the entire thing, right? So when we got here, she said, how do I never get to be that person again? And guess what? I said, well, congratulations, welcome to your retainer. She's like, what, you make one of those? No, not for your spine. But that's where true health and wellness begin. If we've gotten here, when do we want to lose it? Because we always want to be building healthy longevity again. So she basically got a second lease on life, didn't have to go through life with migraines that was shutting her down. And so when we talked about wellness, we talked about you don't have to be on 3 times a week the rest of your life, not unless you have a new injury or an accident or something that drives you in here. But we titrated her down 2 a week, once a week. I tried to spread her wellness out, and everybody's wellness or maintenance is different, and it depends on you. How far you've come, how much damage is left in your spine. If we're significantly degenerating, right, and we're just starting this, you may have wellness that's more maintenance than other people. For her, her wellness was once a week for 12 years. Here's why. I didn't tell you, she worked in technology, her head's down all day long. She's a marathon runner, a triathlete. She had 2 small kids in athletics, chasing them all around. And she functioned best at once a week, maintaining. And so when we look at where our wellness is, my wellness, I was 20, I was a scholarship gymnast at college, hurt my back. We had gone to the chiropractor when I was a kid growing up for injury and accident. We really didn't know it for wellness or correction or anything like that. And so when I hurt my back, of course you're on scholarship, they send you to the orthopedic that the school has, great, school system, UNC system, orthopedics, and they want to do surgery. And they said you have a bad L5 disc, and that's why you're going to have bilateral sciatic pain maybe the rest of your life if you don't do this now, because that's what they tell you. So I get on the phone, I grew up in New York, I call my parents, I'm like, surgery? They're like, not a chance. They flew me home, I had a break coming up, and literally we worked on my spine. We went to the chiropractor, changed my spine. At that time when I had hurt my back over the course of the next several months, I had developed all sorts of ovarian issues, no periods, painful periods, like a whole bunch of stuff. And didn't realize that my spine wasn't in alignment from the start, was probably how the injury also occurred. But he explained to me that the nerves from my low back go to my ovaries, my lower intestine, my uterus, all the things I was having difficulties with. And a lot of that was resolved when we started correcting my spine. So getting her to wellness, she stayed on wellness. Her and her family, her husband, who was the biggest skeptic, her 2 small children who are now in college and graduated, all came under care for chiropractic wellness, for building healthy longevity. With our kids who played sports, they were in here more than wellness a lot of times when they were slide tackled from behind or had injury or whatever that was. But then we truly get them back on track, and then we maintain because they have exercises and stretches, and we're building spinal longevity. That's a guy who thought he was dying. That's his corrected x-ray with no surgery, by the way, and he and his wife are great patients for over 20 years, and now they live in Florida to the guy I tried to refer him to, who was my good friend. And I do get to cover their office from time to time, and I see them occasionally, which is pretty cool to see old patients in another state. Last I want to show you is just a couple of phases of degenerative changes. So if you see your spine and you have some sclerosing, we call this, or spurring, lipping and spurring, I call that the ski slope effect. The discs are diminishing, the nerve holes are shutting down. Think about what's happening on the inside out. Close your eyes and go, what does my spinal cord look like right now? Because if we have no disc space any longer, the nerve holes are shutting down here, how well do you think we're having function and flow to the rest of our body? And your problem might be in your low back, but if we don't address what's happening here, we're not healing here either. So your spine works together. And innately, the way our body works is as a unit, because if you shift one side, your spine's gonna try and take you to the opposite side. You might see your head come back over to the opposite side because we're just trying to compensate our way through uprightness. And that's innate intelligence that, the universe intelligence that God made us with, our brain through our body and our spinal cord. Last x-ray is low back, and we're gonna go back and look at yours. This is a guy who came to my office. You can see this is not a straight spine. Do you get that? This is a high hip here, a low hip, and a big shift. We take a mark from the center where Sharpie's blocking right there from S1, and it should be straight. That's his corrected x-ray. Turns out he was a referral as a second opinion. When I met him, his brother was a patient here. He had flown into town. He has family that has a house here at Figure 8, and he was signed up for back surgery. So in 2 weeks, and he came with a file this thick with MRIs and CT scans and all the stuff. And he said, can you look at my spine? My brother said, why do I just take drugs and sign up for surgery? I go, that's a good question. I would say the same thing. So when we looked at here, I looked at all the doctor's notes. They wanted to do spinal fusion of these 3 levels. He had 2 bulging discs down here. He had bilateral sciatic pain, 1 numb foot. Not good, right? So I said, here's the deal. On his MRI, they found some clouding over here. They found what they thought was a bowel resection, so that's why they did a CT scan. This is a 42-year-old man. This is not an old guy, right? So they confirmed that he has a bowel blockage. Now they want to do a colostomy bag, a bowel resection, post-op and back surgery. And this guy's like, I got to be in London in 6 months. I'm like, you're not going anywhere if you have these 2 surgeries. Plus, it's going to be hundreds of thousands of dollars in surgeries and recoveries and everything. So when we talked about the nerves from your low back, I said, if you have back surgery and they damage these nerves, guess where those nerves go to? Your bowel, your colon, your lower intestine. He's like, shocker. Why didn't the internal, surgeon say anything in the orthopedic? I said, because they're looking at the scope on a microscope of this problem, 2 bulging discs. They're not telling you what's wrong with your bowels because of it. Meanwhile, he's taking opioids for a year, because that's when they hand them out pretty freely, and he's not doing any better, right? So I said, if it were me, I'd cancel back surgery. And he said, well, what am I gonna do? And I said, well, I have a solution. I said, but you can always reschedule it, but you can't take it back once you've had it. So I'd put you on a plant-based diet, I'd put you on a detox regimen, I'd adjust you every day for 30 days to try and force some function. Let's see how far you can get down this trail of healing before you make a better educated decision on what you're signing yourself up for in a lifetime, right? Because it's not just today's surgery, it's what happens after that too. He said, I'm all in, let's do it. So we started him on his adjusting every day. I saw him on the weekends. If I was here, I'd come in on Saturdays or Sundays and see him straight through, because we're trying to mobilize him, and he had a lot of issues. And do you know that in about 30 days, he hadn't had back surgery, his foot is no longer numb, his sciatic pain is gone, he's got some localized back pain, he's pooping daily, and he only was going once a week before. And the best part for him is he lost 25 or 30 pounds. So that's probably 10 pounds of poop, there's no lie on that. So when you look at how healing happened, we just had to remove the interference, which was the subluxation, the misalignments, and restore some function. And we did that from inside out, and then started working with the right foods and detoxifying him as well. We got here, we did spinal correction. That's about a 90 or 120 days in. But he got a call about 30 days when he was doing great. And it was not for back surgery, it was for his colon resection, right? So he's like, well, why would I go? Because they wanted to do a new CT scan to do bowel markers. And I said, you should go, because here's the deal. We have x-rays, but the CT scan's measuring truly what was going on the inside out. You'll be able to see that. They're gonna do your blood workup for pre-op, so we can see your markers for C-reactive protein and all the SED rates that were causing you to have a high inflammation process. And they were trying to say that he might be cancer, right? That's how they diagnosed him without even really checking yet. So he went, and And he sat down with the physician after he had his CT scan, and he's looking at his file. He's scheduled for surgery in 2 days. Looking at his file, calling his staff and saying, hey, I got the wrong file, do I have the wrong scan? And his staff said, no, we've checked it twice, it's the right file, the right guy. But guess what was on this new scan? No valve blockage, it was clear. So when we talked about that, the surgeon said, I don't understand. He said, well, here's the deal. I went to the chiropractor, and he started to explain about his back pain, and that's why the surgery was delayed a bit, because he said he couldn't do those 2 surgeries back to back. And he said, I went and it was on this awful plant-based diet. I've done this detox, and I don't have numb feet or sciatic pain any longer. I poop daily. Isn't it possible that my body could heal and function because those are the same nerves that were blocking and not, communicating with my colon, my lower intestine? And I know the internist in town, he said, yep, in theory, meaning he studied it, he went to med school, he understands it, but that's not how he practices. You go to a surgeon for, a valve blockage, what are they gonna do? Yeah, they wanna unblock it, they're gonna do surgery. They might try and push it out through a bunch of drugs, but obviously to no avail, so they were doing surgery. He said, well, I'm no theory, thanks so much, bye. So, he never had surgeries, 2 that he was facing. He got to full correction and a second lease on life. He said, I'm never going to stop taking care of my body any longer. He got caught up in the business world, traveling and spending money and making money and not taking care of himself. And we talk about how are we going to build health, it's decisions we make every day. We're either moving steps closer and closer to health and life at that 100%, or every day the decisions we make, what? Are taking us this way. And so what are we going to do? Now that you're radiological experts, we're going to go back and look at your x-rays. I'm going to say, what do you see? What do you think that means? And you're prepared to do something about it. Because it always comes down to those 2 things, like you said, time and money, right? The time it takes in here is truly 15 minutes. If you add decompression, another 10 to 15 minutes. So if you're spending, let's say, an hour to an hour and a half of your total week of 168-hour week of your life working on your health, and other people are spending 8 hours at a time binge watching Netflix or Facebooking or whatever people do to waste time, I don't know. Like, we want to get back to building health. And it doesn't take a long time. That if you're here 3 times a week, that's it. That's not a lot to ask to get you back on track. And then how do we get you maintaining that? The other thing, the cost is way less than braces. That's the best news. And I make it very affordable. You'll see families in here sometimes, depending on when you come in, of little kids all the way up to big kids and parents and grandparents, because we take care of multi-generations of families and make it very affordable for them. So I've never turned anyone away for lack of finances. I have for lack of commitment. Because if you're not committed to doing the work, I can't meet you halfway to get it done, right? All right, that's good. I'm gonna take you 2. We're gonna go pretty fast. I'll be next with you, all right?